That looks perfect.
Awesome. Okay. So thank you, everyone. I'm happy to be talking with you all today, really about this idea of how telehealth has changed caregiver roles and responsibilities in healthcare in the time of COVID-19. And I just want to really start by acknowledging that telehealth is really a new way of life for most, if not all of us. So I definitely don't come here as an expert in telehealth, but rather some of my goals for this presentation today are really to provide a forum to share experiences of telehealth from a variety of perspectives. Also, hopefully to offer some suggestions to maximize telehealth sessions, and also to really share some ideas that could be helpful for reducing caregiver stress at this time, based on just some of the things that we've learned through some of our programs here within developmental and behavioral pediatrics at URMC. So I know Melissa had talked about the Q&A box being a source of question asking, but I also invite you, just in sort of continuing this as a forum for sharing experiences, if you feel comfortable at any time sharing experiences related to any of the things that I talk about today, feel free to include those as well in the Q&A box. And hopefully if we have time, we'll be able to share out a little bit at the end. So what I'm hoping to talk about today is first just to provide a little bit of context for the world we're living in right now, and why telehealth has become so important. And then to share some results of an experiences of using telehealth survey that I distributed over the past few weeks to some providers and parents and caregivers in our local area, just to get a better sense of what perspectives are on telehealth and how it's been working thus far. And from that, I'm hoping we'll be able to talk a little bit about some tips for maximizing telehealth visits, how we're adapting as a clinic to telehealth at DBP, and then also just offering some thoughts about how to help manage some of the added stress that is happening in our world today. So really the context of my presentation and of this topic is that really the COVID-19 global pandemic has impacted how we live our lives. And this is really impacting how we interact with everyone in our lives, from our school teams to our family members, and also with our healthcare providers. And in many parts of our lives, virtual options have replaced those in-person visits. And you may be experiencing this with, seeing extended family members over Zoom instead of in person. A lot of us, especially since we're in the fall, are shifting, our kids are shifting either to full or hybrid models of virtual learning. Many of us have been or still are working from home part or all the time. And therapy and healthcare are no different. So a lot of us are having to navigate these visits over our computer screens compared to going in person. And I think a lot of the shift to these virtual options has us all taking on new and additional roles. And I think that this, can't be emphasized enough for caregivers. So thinking about roles as, being employees or managers at work, being teachers, some are part or all of the time as we're now helping our kids in virtual learning, having to be involved more with virtual therapies and working to sort of put on this new therapist hat, being family members of other than our children. So being children of elderly or aging parents, trying to maintain relationships with spouses or partners, and maybe being caretakers for other extended family members. And then also acknowledging our role as ourselves still. So thinking of our own needs and demands that we're all dealing with, and how that really can add more stress and less time for ourselves. And so I wanted to take a minute to highlight a little bit about caregivers as therapists. And so what we what a lot of us are experiencing is that caregivers may be taking on a more active role, especially in these times of virtual therapy. And so I think we can compare it, in my own experience to sort of direct therapy. I know within our clinical services, for example, our feeding services or some of our behavior services, it was really a lot of time where the clinician and the child were spending time one-on-one, doing a lot of therapy that way. And now with this virtual model of everything being done over Zoom, a lot of these things have transitioned to what we call caregiver mediated therapy. So now caregivers and clinicians are spending time on Zoom, collaborating, finding ideas. But really a lot of the emphasis is falling on the caregiver to be that sort of agent of change at home. And that has kind of both benefits and challenges. So we can think about benefits maybe are that as a caregiver, you may feel more involved in therapies than you were before. So at school, maybe your children were receiving therapies and you would have communication with that therapist, but may have not seen the ins and outs of the session like you are now. You may be receiving more coaching or direct feedback and ideas for how to use therapy strategies at home, which can be an added benefit. And also you're really able to bring your expertise in your child and your role as their first teacher to hopefully maybe have more of that collaborative partnership with your child's therapists and providers. And we also know that many challenges come with that. Engagement online can be really hard. It can also be that you no longer have direct interactions with your provider in person, and sometimes that can just feel different. And also home really has a lot more natural distractions. So there's other family members in the home, there's fun toys and electronics to compete with, and also a lot of life things. So phone calls happen. The mail carrier stops to deliver your mail in the middle of your session. Maybe your dog or cat barks at the mail carrier when they come. All those natural distractions that come up at home, we really don't see a lot in the clinic. And that's really just adding to possibly some of that stress or these added roles that you're taking on. So one of the ways that I was curious to hear about some of these experiences, both from provider perspectives and parent perspectives, was through developing a quick survey called Experiences of Using Telehealth. And this is just a brief overview. It was a brief survey. It probably took 5 to 10 minutes and really just collected some simple information about folks' role. So are they a provider? What type? Are they more coming from a parent or caregiver perspective? What types of services they've been involved with over telehealth. There was a few simple statements rating kind of agreement with some different parts of telehealth. And then a lot of the survey was open-ended questions. So being able to really provide paragraphs or sentences about your different perspectives, about how telehealth has gone for you, what some of your thoughts are about it, and then also maybe some creative ways that you've used telehealth as we've all adapted in recent months. And so over the past few weeks, I was able to give folks time to respond to this survey. And we had about 28 people get back to the survey. About 36% were caregivers and about 58% were different providers. So this survey was distributed within our DVP, listserv, and some other places within the medical center, such as the Complex Care Center right here at URMC. And what we found, so folks were able to indicate what types of services they were involved in. So they could indicate as many of these as they wanted. So overall, we know about almost 3/4 were involved with some sort of medical visit over telehealth in recent months. About half were involved in some behavioral services. And another about 20% were involved with some other services. So for example, some of those related services like OT, PT, and speech, or our diagnostics clinic here at DBP. And so first we're rating some agreement with different statements about telehealth. And so you'll kind of see at the bottom the scale that was provided. So 1 or 2 is sort of I disagree or strongly disagree with this statement, all the way ranging up to 4 or 5, meaning I agree or strongly agree. And so we can see from everyone's responses, so this is everyone included, that, in general, folks are agreeing that telehealth makes getting visit services easier, and also that they would probably recommend telehealth to others. And I like to think about this in a way as sort of how satisfied were you with telehealth, and that you would then take it a step further and tell someone else to do it too. But I think there's also things that as a group we're all really unsure of still. So things like a telehealth visit is effective at helping me achieve my goals for a session, or I think using telehealth is just as good as in person. I think we're still figuring that out, how we feel about those different things. And so the next few slides, I'm not going to spend too much time on, but I just wanted to, I pulled out sort of comparing caregivers to providers, just to take a look at the different questions and see what folks were thinking. And so we can see here, for example, that in general, providers may feel one way, so agreeing or strongly agreeing that services are easier, but still for some caregivers and families, there may be uncertain, or maybe even one person responded strongly disagree. And so we can kind of see how while we may all be feeling in a certain way, once we break it apart, there's some differences that we may experience depending on where we're coming from. I think something similar came up in terms of looking at how effective telehealth is at achieving our goals. And I think something that could be noteworthy here is just thinking about what we may go into sessions with as our goals or expectations. And I could see how that may be, different from a provider standpoint versus from a caregiver standpoint. We can also look at, that using telehealth is just as good as in person. Again, there was some more caregivers maybe falling in that disagree or strongly disagree. And, we'll get into some of those limitations that were identified, but, sometimes it can really feel a lot different to have an in-person appointment versus telehealth. And then the same with that satisfaction or that recommending telehealth to others. There was a little bit of difference between providers and caregivers. And again, I think this just highlights that we're all coming from different perspectives and maybe experiencing different strengths and challenges of telehealth. So one of the things that I wanted to share is just some different quotes. And so again, these next slides look a little bit text heavy. And my intention is not to read and sit and read all of the quotes to you, but rather for you to have them to go back to, you'll have these slides to look at. But, my hope is that I was able to find some common themes that came up within the responses. And that, there may be some similarities that all of us are experiencing regardless of our role with telehealth, and also some differences. So my hope is that you may hear some things that sound like you, or maybe some things that you hadn't considered before. So the first section is going to just be some caregiver thoughts on these different questions that I presented in the survey. And the first is, telehealth working well. And so for this, there was a number of things that appeared. So the first is that really we're finding that telehealth is good for straightforward questions. So you'll see here, one of those quotes a caregiver provided was that they were able to send a picture and received quick assistance. So for those really concrete, straightforward questions, telehealth is generally working pretty well. I think there's also this idea of efficiency and convenience. So I think minimizing transportation and long drives into the clinic was something that really came up throughout this survey. So helping save gas and travel time, having that flexibility if the weather isn't too good. That's really a way that telehealth is working well. And also minimizing gaps in service. So when we think back to that time where we really had a transition from in-person to telehealth in the winter, for this family, they were, able to ensure no visits were missed for their child's emotional therapy and support. And so it's one way that, we're able to minimize some of those gaps. And within the survey, caregivers also acknowledges some challenges to telehealth. So sometimes there's communication difficulties. This person noted it's hard to get a provider a good visual if there's something you want them to see, maybe when we're limited to a phone or a tablet screen. engagement was a really common theme that came up. So really having a hard time, whether it's being disinterested in Zoom sessions or just not being able to kind of sit and pay attention to a screen that long. That's something that came up a lot. Technology issues are also something that I think we're all struggling with when it comes to telehealth, whether it's learning how to use Zoom, as this one quote mentions that I like is, technology is great when it works and it is frustrating when it doesn't. So there are times where, we may have to switch to a telephone call, or connection issues are really impacting our ability to talk back and forth. And that really is a challenge that all of us are noting. And we'll see that in the provider responses as well. And also the idea that life happens. So, one family noted remembering to log on time is really hard. And I think, for in-person, we're used to having to set aside that travel time and time to get into the clinic. We're sort of in that mindset. And when we're at home, all of that gets really blurred together. And so sometimes it's just remembering to log on can be a real challenge. So again, these are some perceived strengths. So this is sort of what do you think are some strengths of using telehealth in general? And again, that efficiency and that convenience came up. And also the idea of being more comfortable. So, it's nice when you're waiting for the provider that you can do that in the comfort of your home, one person mentioned. So, not having to wait in the waiting room or having time to wait in your car, but just being able to sit at your own table or on your own couch and be ready. And also some of those perceived challenges. So again, these came up again, that idea of difficulties with technology and difficulties with engagement. I think another thing that came up was just limitations. So if we think about that, 3/4 of people were experiencing medical visits over telehealth, things like vitals not being able to be taken was really a challenge for, I think, caregivers and some providers alike. And then also managing family needs at home. So as one person noted, it can be challenging when you have other children to care for while you're trying to focus on a televisit. So, in some ways it may minimize needs for childcare. And on the other hand, everyone is home and we're all in the house and we're trying to also have a visit at the same time. And that can really be a real challenge. So next was a question about what is something creative that you've been able to do to help a telehealth visit go a little bit smoother. And I like to share some of these ideas in terms of, flexible, and I like to point out safe locations. So I know some folks were mentioning, someone said they did a session in their car. Obviously, we want to set up things as safely as possible. So, we definitely wouldn't approve of, driving while having a telehealth visit, which will come up later. But still, it gives you that flexibility of location to find a spot where you're comfortable or where it's quiet. And a lot of people noted creativity as finding a comfortable spot in their house to make sure the visit goes well. They also noted taking advantage of resources that we may not have thought of before. So one person noted using their phone flashlight so that the provider could see inside their child's mouth for a certain type of visit. And then also finding ways to support your child. And I really like this note, which is having have something that my child can do quietly, but not to engage that they can't answer questions. And I think that that's a nice, that creative way of finding a balance of keeping them occupied when you have to talk, but also not so consumed that they can't kind of be able to answer questions or do something that the provider may need them to do. And finally, I asked caregivers to just give any other helpful information that they think they would want other caregivers to know, other providers to know. And I think that both of these quotes really highlight just that, telehealth is great in some ways, but may not be for everyone. And so as the first person basically said that, it's not for everyone, but for some, it's a great option. And a second person wrote that telehealth won't replace an in-person traditional appointment, but it can bridge a gap to ensure connection, continued interaction, and ongoing care. And I thought that that was just a nice summary of maybe how we're all feeling right now. So given that we're all experiencing telehealth, I wanted to share a little bit from providers' perspectives as well about, their perceptions of telehealth. And again, I think that sharing both of these perspectives can just help us have this forum and this communication around how we're all coming to telehealth appointments, and just acknowledging this is new for all of us. And so I think we'll see a number of similarities and also some differences. So when I asked providers what's working well for telehealth, they really noted, many of them noted the effective use of that session time. So again, minimizing that travel time. As you see in the second bullet, one provider noted, I've been able to save parent time away from work and child time away from school. So really helping us all minimize the time that we're spending in that transition and just sort of getting the appointments done when we can. And I think that all these things kind of highlight just how we can be efficient over telehealth. This is another point that came up a lot in terms of telehealth working well from a provider's perspective, is getting a little bit of insight into the home environment. And again, I think this goes both ways, that perhaps families are also getting a little bit of insight into their provider's home environment as well. But I think that, often when we're meeting in the clinic, it's a pretty neutral place, and we're able to sort of bring in what we can, but we're not getting a snapshot into each other's home lives. And I think telehealth has really changed that, and sometimes for the better. So, being able to, for example, get to see what I got to see what life at home looked like. Or another person noted being able to see toys and the setup of the home. And I think especially for some of our behavior cases, for example, one of the clinics I work in, a number of our cases are toilet training cases. And so this provider noted, telehealth has been great for some of my toilet training cases. I have been able to see the bathroom at home. And so thinking about the benefits that can have for kids and families of really being able to do intervention in their own environment rather than doing it in the clinic. And this has been really a positive experience for providers and hopefully families as well. Providers also noted some similar challenges. So you'll see on here those things related to engagement and technology. But some different things also came up. So things like distractions during sessions can sometimes be really difficult to manage. And I think that there was a number of points of just really emphasizing for all of us that telehealth is our real appointments. And so being done at the supermarket may not be the best option, especially when we think about, oftentimes we're really talking about personal and private information. And you'll see here, that note about driving, but, one provider noted that a parent was attempting to participate via video while driving and it felt unsafe. I ended the visit and rescheduled later. And so again, thinking about the benefits of that flexibility, but also reminding ourselves that safety is definitely our first priority. I think related to that idea that we're able to get a snapshot into homes, I think the other challenge is that this does sometimes lead to a lack of privacy. And so we can see here, someone noted that the loss of privacy for visits has changed opportunities for effective work. A few cases, parents did not want to use Zoom, apparently due to the sense that it would be intrusive. And so there is that blurred boundary between having privacy in our homes versus doing therapy in our homes now. And for some families and some providers, that's not always the best fit. And then also a general lack of in-the-moment team support. And so a lot of times in our clinic, we have a whole team of providers who can work together behind the scenes. And one provider had noted, just being alone as a provider at home, perhaps when a patient or a child is experiencing some behavioral or emotional distress, and just how that can really present a challenge. This is, again, the same question, but from a provider's perspective in terms of perceived strengths. So what do you think is a strength of telehealth? And again, we see that convenience and ease. So less stress transitioning for many patients was something that was noted, as well as using services effectively. So, for example, improvement in using MyChart, which is one of our electronic ways to share information and communicate has really been a benefit from the provider's perspective. And I also like this idea about flexibility. So, being over telehealth really provides opportunities to flexibly include different members of the family. So not just the patient, but also thinking about siblings who may want to participate or need to be present. And also that multiple caregivers may be able to log on. So before, if a caregiver was working or needed to stay home for other childcare purposes, some of those barriers may be able to be minimized because we can all connect via Zoom. So this is some perceived strengths. And also some challenges. So again, we can see some similarities in terms of that engagement piece and the technology barriers. Providers also share, especially for those medical visits, those difficulties with completing those visit tasks. So things like vital signs or a lack of an in-person physical exam can sometimes be a limitation to some visits. And then I think that in terms of some of those competing demands, not just of the distractions, but I like how one provider put it as over-zoomed. So a lot of us may be feeling over-zoomed on some days, and that sometimes just adding one more session feels like more of a burden than a help. And that can also be a challenge. In terms of creativity and telehealth, I just like to share these out as ways that providers are working with families to hopefully make the sessions go a little bit smoother. And I think about, the first one in terms of finding fun ways to engage. So as one provider noted, they've been singing maybe some Baby Shark more often now, but also thinking about things like screen sharing and being able to share YouTube clips. I've definitely used as a reward for engaging in a session, why don't you share your screen with me and I can watch one of your preferred games or preferred videos. And so using that as almost a positive to wrap up a session and being able to screen share. I think also being flexible and creative in telehealth is really important. So, the first quote under here that I'm sure many of us can relate to is that kids often get distracted by themselves on the video screen, and perhaps as adults we get distracted by watching ourselves as well. And so this provider noted that a parent placed a sticker on the computer screen over the image of the child to sort of just minimize them wanting to just watch themselves rather than engage with the tasks of the session. And I think related to that is also thinking about that balance of even having the video on. So one provider noted that for working with a child with social anxiety, turning off the video helped make the child feel more comfortable. And I know I've experienced that too, that especially transitioning off of a long day of school Zoom can be really hard to then sit and be back on for a video. And so I've had kids that at least at the start, we start with the videos off and we just kind of get comfortable. And usually by the end of session, the video comes back on. But, being able to be flexible and just say what will help this session go well right now? Do we have to have our videos on? In some cases, yeah, we do. But in other cases, maybe it's okay that we don't. And then I think the last thing that I wanted to highlight from the provider's perspective in terms of creativity is just some of the innovations that have come out of using telehealth to provide care. And so this last quote highlights that nationally there's been a collaborative movement to embrace the telehealth ASD PEDS to help in telehealth diagnosis. It would have taken us years to get to this efficiency and convenience in diagnosis of young children, if not for necessity. And so I think what that really highlights is that, not only are we as providers adapting what we're already doing to telehealth, but we're also finding new ways pretty quickly to be able to roll out these services to the community. And so I think that that's been a really nice highlight of telehealth as well. So I also asked providers for any other helpful information that they would want to be shared with our broader community. And these were just some of their thoughts. And again, I'm not going to read them all, but I just wanted to highlight, ways that we can really maximize time and resources is always helpful for everyone involved. So things like preparing as you would for an in-person appointment, completing questionnaires prior to visits. These can all really help the visits go more smoothly. And also, again, as we're thinking about those ever-changing roles as caregivers, just thinking about how your support of the session may look a little bit different, whether it's having that more active role or just sort of facilitating the visit in a different way. So one provider noted that oftentimes they may be talking, the adults may be talking directly, but they may also still be observing the child out of the corner of their eye. And just remembering that that's usually part of the appointment and the evaluation process that sometimes can get lost via telehealth. So sometimes that can just be something nice to consider. And I think lastly, any other helpful information, and I like this to wrap up this section, is that just really that we're all in this together. And so this person really noted that everyone is adapting. Parents, children, providers, all parties need to have realistic expectations for what anyone can do in this unprecedented time. And I think it's just really important to highlight that really we are all in this together. We're all learning together and adapting together. So one quick thing I wanted to share is something related to a project that we had been doing prior to telehealth. And this was within our DBP clinic. And so telehealth itself was not new to DBP. It definitely increased in volume and who we were seeing via telehealth during COVID. But this was a similar question, which is that recommendation question. So I would recommend telehealth to others. And on the left, you'll see the results of that question for the caregivers involved in our Corning project, which was working with rural families in the Rochester area, compared to during COVID, which was the current survey that I've just spent time telling you about. And I think we'll really see here quite a difference. You'll see for the Corning project, all caregivers were saying they agree or strongly agree that they would recommend telehealth to others. And this looked quite different for our current survey, where the responses were much more mixed. So, we had a small group of folks, but we had about 20% that said that they disagreed or strongly disagreed with that statement. And I think the one thing to consider is that really this time around, we were pretty much thrust into telehealth. This was not our choice. It sort of was, again, put upon us. And so I think it's important to consider the context when we're thinking about our perceptions of telehealth. And so to summarize that data in general, I think that we can think about these points. So one is that we know that telehealth has both benefits and challenges. So in some cases, telehealth minimizes barriers, whether that's decreasing transportation or travel needs or need for time off, reducing needs for childcare or reducing gaps in services. But it also has challenges, and a lot of this seems related to some of that engagement. So it can be difficult, whether it's due to child or other factors, technology, or the fact that there's just competing demands at home. As that last slide highlighted for us, our perceptions of telehealth may really vary depending on context, our context currently being that we're in the middle of a global pandemic. And we also can feel confident that there are ways that we can work together to maximize telehealth sessions. And what I want to move into next are just some tips that we've been able to come up with from our own DBP clinic to be able to share. Some of these may sound familiar, some may be new. And so these are just some tips for telehealth appointments. So the first thing that I think came out a lot of that data is really being prepared just as if you were still coming into the clinic. So having things like paperwork or questions prepared if needed, having the materials that you need at the ready before your appointment. And I think most importantly is making sure that everyone needed is present. And this includes making sure that your child is awake and ready for the appointment. So more often than not, the kids will be required at the appointments, and just making sure everyone is there and ready. I think like many of our caregiver responses had indicated was kind of taking that assessment of your environment. So finding a quiet spot to log on, letting other family members in the house know that the visit is going to be taking place, minimizing some of those distractions like the TV or tablet time, and also finding that appropriate environment where you can concentrate. So perhaps being at the store or, driving in your car would definitely be a less than ideal environment. and to kind of work through that with your provider to either reschedule or find a way to be safe and engaged. We all noted a lot of those technology challenges with telehealth. And, while I'm not sure any of us will be able to solve the frozen faces on screen or choppy connections, I think we can think about just having, having your device charged and ready, or having a charged device nearby. Really testing out the app you have to use ahead of time. And we have great support staff at our clinic who are always willing to answer questions if you're having trouble with your Zoom code or how to do video on your Zoom. So, we have a lot of resources for that. I think another tip that many of the caregiver responses highlighted was considering child's needs and behavior during the visit. So having those activities or snacks prepared, not only to keep your child occupied, but also to have available, say, if your provider wants to observe you or your child engaging during the visit, or to see what your child is doing during play, for example. And also remembering that there's video options. So a lot of times I hear things like, oh, like there's this one behavior that they do. I wish, it didn't happen today. I wish you could have seen it. And so thinking about, feeling welcome to take video beforehand and have that available at the visit to be able to talk through that issue, even if it doesn't happen in the moment of the session. And finally, I think it's important to remember, as that one quote said, that we're all in this together. So I think that being patient with one another is really important. This definitely works both ways. So, considering that, your provider is working to make every effort to be on time, but could be wrapped up with another family or another meeting, and if they're running a few minutes late. And likewise, your provider is going to be mindful that things come up in your life as well. And so that flexibility piece, I think, is important for all of us to remember and can really help us with some of the stress of these visits. And also considering those goals and expectations. So I talked about that earlier, that, we may be coming in with different goals or expectations. And, being able to communicate about those things with one another, but also remembering that, many things can be done with a video visit. So oftentimes we can work together to rule out certain conditions or discuss resources or helpful tips via telehealth without an in-person appointment. But also feeling confident that if your provider feels an in-person appointment is needed, that they will be making an effort to have that in-person appointment with you as soon as possible, to make sure that they are able to provide the answers that just may not be able to be provided adequately over telehealth. So in terms of how our clinic is adapting, I may have mentioned a few of these along the way, but one of the ways that we've shifted is both to more telehealth, so that increased volume of telehealth for a variety of our services, but also really focusing on those caregiver-mediated models. So like I mentioned, that sort of caregiver role as therapist in a way. And this has looked different for a number of our visits. So things like and these are some visits I've been involved in, is, our diagnostic clinic. So that tele-ASD that I mentioned is really this option of diagnosis for young kids that really involves more provider giving coaching to caregivers and sort of observing those parent-child interactions right from your home over the computer. And that's one way that we've adapted to that caregiver model. We've also adapted a number of our other services quite successfully to telehealth. So I know our feeding clinic, for example, they've really found it really beneficial to be able to see families not only in their home, but in their kitchen, and be able to see what's in the environment, be able to have the child sitting at their actual table or high chair or booster seat right in their home. And that's been really an invaluable switch to that team. And then we've also responded directly, not just to telehealth, but to the COVID-19 pandemic. And this is, we call it COVID BIF, and BIF is our Behavior Intervention for Families program. And, uniquely, this this type of service was already caregiver mediated. So a lot of this was really the clinician and the parent collaborating together to then have time to go home and practice and bring that back and troubleshoot what went on with certain behavior strategies. And within this type, we actually took that a step further and adapted it just to COVID. So it really focused on thinking about, what are some priorities and goals, not just for my child, but for my whole family. How can I provide structure and schedule at home? And also, how can I remember to include, elements of self-care for myself? And so some of the last bit that I'll be talking about are some of those concepts from our COVID BIF program. And I hope that they'll be helpful in considering. So in terms of managing stress of these new and changing roles, oftentimes it can be really helpful to start by just assessing family goals and priorities. So spending more time at home may shift the focus of family goals and priorities. And as these roles and boundaries become blurred, especially for caregivers, we may be spending time all together at home, but needing to get different things done, whether it's work or school or recreation time. And really setting these realistic goals for each day, yourself included, can sometimes really help. And I like to think about putting it in perspective that not everything can get done every single day. And so sometimes I like to think about, what are the top 2 to 3 things that each family member needs to get done today? And for some kids, that looks a lot different than for what some adults do, but you're really thinking of your whole family. What needs to get done today? And sometimes, because we're at home, this may mean new or different goals for families or for family members. So I think some of the things that we've really heard from families and have worked with families on is things like daily living skills. So being at home really lends itself to being able to work on things related to hygiene or cooking or doing things around the house that maybe we just wouldn't be able to do in a traditional classroom setting. Sibling conflict, or rather working on sibling cooperation, is something that has come up a lot, and which can really be a goal for families, is helping siblings get along better or knowing when to take a break from one another. So that's something that can maybe be worked on as siblings are spending more time together at home. And then also thinking about physical activity and recreation. For a lot of us, we're spending, children and adults alike, we're spending a lot of time at desks, at computers, at dining room tables getting work done. And so really trying to get in that physical activity or recreation each day can look really different for each family or each family member. But for some families, that can really be a goal, is being able to get outside or take a walk or things like that. And all of those can really shift into focus with a lot of this time spent at home. Within this, I think it's important to also think about the structure of your day. And so again, the answers to these questions are going to look really different for each family and each family member. But thinking about those really big parts of the day. So when is school time? When is work time? When are meal times? Some families are more flexible with when meals are. Some families keep more of a routine with meals. So thinking about how does that look for your family? Thinking about that other to-do list. So what other things need to get done each day and when are they going to happen? And then also thinking about what's going to fill in those gaps. So will we have more outside time? Will we have a time for rest or quiet time? Will there be designated electronics time? Maybe yes, maybe no. But thinking about the structure of the day. And, sometimes structure, if we think about things like scheduling, it can really look like down to the minute. And sometimes, especially within this program, I talked a lot with families about structuring the day more into like morning, afternoon, and evening. And what, these are the 3 things we have to get done. When are we going to do them? Okay, this is going to be in the morning. This is going to be in the evening. We're less maybe worried about, we have to have something at 9, at 10, at 11, at noon. So sometimes just reframing the schedule and the structure of the day can be really helpful. And then I always encourage families to write it down and adjust as needed. It doesn't have to be perfect the first time. And so relatedly, some families and some kids really take to using visuals to support this daily structure. And I know we have so many great resources. I've included one with our Autism Treatment Network Toolkit. I know we also, on some of those intro slides, have some resources on our DBP page related to visual supports. And I also like to just remind folks that simple and homemade works too. So no printer or laminator needed sometimes. And so this can really look like cutting out pictures, using your smartphone or tablet to take pictures of things like your own dining room table, if that's where work time is going to happen, and being able to use that. Using things like sticky notes and sticking them to the fridge or to the wall that you can mix and match depending on the day. These all provide that same visual support, but maybe just not in a sort of laminated Velcro fashion. And again, different things work for different families. I just like to highlight that it can look really different. And then lastly is just things to think about in terms of reflections for parents and caregivers is, even just taking a step back and considering, interactions with your child. How have they been looking lately? Stress and frustration are understandable and quite frankly expected during this time. And how have your interactions been? This just kind of gives you a little bit of a pulse on how things are going. So have interactions been more positive? Have they been more negative? Is it really a mix of both? And again, there may not be a specific answer of how to address these, but sometimes just that acknowledgement of kind of the barometer of the climate of how things have been with your relationship with your child can just be helpful to consider. Also thinking about any positive attention or praise you can provide to your child. And I like to think about this as really responding positively when you see your child doing something good. And so thinking about, the language we're using. Do I feel like I'm always saying, stop, no, don't do that? Can I switch that to, oh, great job sitting in your chair, or, oh, thank you. I really appreciate that you put your dishes in the sink today after dinner. Thinking about those ways that we can respond positively, tell our child what to do, and also to give that attention or praise when something is good that they've done. And I think also, understanding that you're the expert in your child and you sort of know the best ways that these things can be delivered. So some kids really like a verbal praise and being told they did a good job. And for other kids, that's just not a great fit. And so thinking about other ways, I know some families I've worked with have used more nonverbal cues. So their child really liked thumbs up or a quick high five, or a quick pat on the back if the parent noticed them doing something. And so this is really where you can, take your expertise and be able to know what works best for you and for your child. And then lastly is just thinking about your own self-care. So going back to the very start and thinking about, all of your different roles and including one of them as your role of yourself, and thinking about all those different roles and personal stressors that you're experiencing, and remembering to take time for yourself. And even 1 to 2 minutes can make a difference. And again, I'm sure this is something that everyone has heard and perhaps rolls their eyes at or feels a certain way. And it can be really, really hard to find that time. But sometimes this can really just start with considering what helps you feel better, what helps you manage your own stress. For some caregivers, that's making sure to get in exercise, whether it's going for a walk or doing a quick online class. For some, it's just taking that 1 to 2 minutes to brew some tea or an extra pot of coffee to get through the day. And some is prioritizing that quiet time, whether that's taking quiet time when your child does, carving out a space for yourself in your house that you can just take 5 minutes to take some time for yourself to get into the present moment. And I've also included a link for a couple of mindfulness resources that we've shared with some families. These are web and phone app options, if these would be something that you would be looking to incorporate into your own coping strategies. And lastly, I'm just going to end with a quick graphic. So this is something that was shared, I think, pretty early on within our switch to telehealth and some of our COVID-19 restrictions. And, within this, I think I'm less concerned about what some of the specifics are. So I see a call back to those times we perhaps were all worried about the amount of toilet paper at the store. But I think about thinking about what you can control and what you cannot control. And, these things may look differently every day, every week, every minute. But thinking about, the inner circle is I can control these things. These are the things I'll focus on. And then outside of that are the things that I cannot control. So I can let these things go. And so sometimes just this exercise of thinking of all those things that are running through your mind, all the things you have to get done or that are bothering you or worrying you, sometimes just categorizing them into I can control these, I can't control these, can really help us just know where to put our efforts if we're feeling a little bit overwhelmed. And so lastly, I just wanted to do a quick thank you to Dr. Kavanaugh for her help with developing this presentation, and also our DBP psychology team and Sam from our DBP research team for their help with the survey as well. Our DBP providers and families, as well as all those who took their time to give feedback via our survey that I was able to share today. And then also the Skirball Conference for having me today. And I hope that this presentation just helped a little bit to get some ideas and to understand that, we are really all in this together. So yeah, that I saw a few alerts, but Val or Melissa, if you have any ideas, I know we have like just a couple minutes.
Yeah, thank you so much, Allie. The comments in both the chat and the Q&A, definitely relatable to some of the tips that you were sharing at home. Even when it comes to visual supports, I love how you shared that it doesn't have to be laminated and perfect for these supports and schedules at home. Someone recommended they use messages on the mirror with a dry erase marker and things.
Oh,
and
that's
really
awesome.
being flexible, yeah, for supports around the house. So one of the questions for you, we're hearing a lot from families about the use of screen time during this pandemic at home, and wondering if you'd be willing to share some perhaps coping strategies, how, to cope with the effects of long periods of screen time, or what you would share with parents around screen time, especially, if that means them getting that moment to themselves.
Yeah, absolutely. I think you kind of highlighted it that, I feel like it's hard to put a right or a wrong. I think sometimes there's this, this thought or this idea that, oh, there's too much screen time or things like that. And I kind of think about that last graphic of like can and can't control. Like you said, if that's going to be able to give you 5 or 10 minutes to get something else done in your day, I think it's really just thinking about, your comfort level and also those priorities. Like maybe the priority that day is not that today is going to be the day where we have less screen time. Maybe today is the day that I have to prioritize doing something else around the house, and screen time, I'm just going to let go of that for today. So I think it's less about strict rules of like what you should and shouldn't do with screen time, but more just kind of considering it within that context of your family, what needs to get done. Did your child already spend 5 hours today on online schooling and they need that break to watch their own tablet time? So I think it's less of a right or wrong and more of just thinking about it within the context of sort of goals, priorities, and, knowing that screen time is just one small slice of life right now.
Thank you so much. Absolutely. And we do perhaps one more question. So you were able to expand on examples of how families can make their environment at home more telehealth friendly. Would you be able to speak to, any tips on how families and providers can collaborate or communicate, whether it's in the appointment or before the appointment, or any ways that, would be helpful for both to open up that line of communication more?
Yeah, that's a really great question. I think one of the things that was highlighted on the provider's side is that use of like my chart and being able to get things done ahead of time. And so sometimes that can really maximize that time in session to be able to talk or just have more time to share that communication. Because you're able to get that information ahead of time. I know I saw recently I think it was maybe even via my chart or just some initial questionnaires that can go out ahead of time, is there even is a spot for families to now indicate, like, these are my top 3 priorities for this session. Like, these are the things that are going on, and like, I want these on our agenda to talk about. And so I think, yeah, just even like setting that agenda, or being able to start off the session by, both sides being able to say, okay, these are my top 3 goals for this session. What are yours? And vice versa. I think just having that line of communication can be really helpful at the start of appointments, just to kind of set the stage for kind of what needs to get done that day.
Terrific. Thank you so much, Allie.
Mm-hmm.
I'd like to just share a few comments in the chat too. Many people sharing their thanks to you. And wonderful tips. We will make sure that these slides and a recording of Allie's presentation today will be uploaded to the event website in the coming days. So feel free to share that link of the recording with others. And we hope to see everybody again. Our next session is this afternoon at 1 p.m. with Linda Matons, looking at some behavior strategies in what we're calling our new normal. So we hope to see you there, and then sessions will also kick off again tomorrow, Saturday at 9 a.m. So thank you for joining. Thank you so much, Dr. Jordan, for this wonderful presentation, and we hope to see everyone soon. Have a great afternoon.
Thank you.